Ever felt, profoundly misunderstood? Especially when it's about your health. Today, in the deep dive, we're looking into something hidden, really, in electronic health records, EHRs. It's about how the official record, well, it can be vastly different from a patient's actual experience. We're diving into this study, focusing on non-college educated women, and it reveals how this gap in documentation can actually make health disparities worse. Okay, so let's get into it. We hear a lot about adding social determinants of health, SDHs, into EHRs. The idea is to help patients, right, improve care. But what did this study find? How does this actually work out in, the real world?
Yeah, it's fascinating, isn't it? Because the intention is good, but sometimes things can go a bit sideways. These SDHs, they're meant to capture big systemic issues like poverty, housing problems, but what the study shows is they often get logged in the EHR as like individual problems, personal risk factors.
Okay, so societal issues become individual failings.
Exactly. It kind of reframes these broad challenges into something about the patient personally, and that can unfortunately lead to stigma.
Right. And the study gave some powerful examples, like Lacey. She felt a doctor treated her like a welfare mom, just because of her housing and not having an air conditioner. But that feeling she had,
Yeah.
being attacked, feeling judged, her view that this info was like ammunition,
Yeah.
it completely vanished from the EHR note, even though the note itself sounded kind of empathetic on the surface.
Yeah, that's a key point. When social censoring gets translated just into a risk factor, you lose so much context. Think about Crystal. Her record noted tobacco use, okay, but didn't connect it at all to her grieving her parents or maybe the stress from her job.
And her weight.
Same thing. Noted, but without mentioning her fear, her actual fear of walking outside because of racism she had experienced. And critically, her own worries about her seizure meds making her feel like a, quote, zombie. That wasn't in the record either.
Wow. So the patient's own perspective on what's happening to them, it just gets lost.
Often, yes. Especially when there's a perceived conflict.
Okay, so tell us more about that. What happens when a patient maybe disagrees with a diagnosis or has a bad reaction to treatment? How does the EHR handle that conflict?
Well, this is where it gets really concerning. The study found those disagreements, or even just the patient's own knowledge about their body, often they're just suppressed or like completely absent from the record.
Persist.
Yeah. And the danger there is that the patient can then be subtly framed as maybe difficult or unreliable down the line. Look at Avery's tragic story. Losing her baby daughter, then the SSRI she was prescribed made her feel worse.
Oh, no.
And she felt her therapist minimized her grief. But none of that, the conflict over the meds, her feelings being dismissed, none of it made it into the EHR.
That's huge. Or Kate
Yeah.
Wright, battling severe pain for 20 years.
20 years, yeah.
And her chart just kept saying it was about being overweight or overeating to self-soothe. Even her experience of being, as she put it, attacked by a supervisor that got put in scare quotes in the record.
Right, diminishing her experience. And her pain was only really taken seriously when her husband stepped in.
So it took male intervention for her pain to be validated.
It seems that way in her case. And it highlights this larger pattern the study found. Women's knowledge, their frustrations, even their valid reasons for maybe resisting parts of the health system, it gets erased. Like Annette turning to alternative medicine because of a massive bill, or Laura avoiding doctors because she felt they just can't fix her kind of pain.
Yeah.
That context is lost.
Leaving this massive gap in understanding.
Exactly. And potentially misinforming future care decisions.
So bringing it all together, what are the big takeaways here?
Well, these ongoing differences between the record and the reality, they really chip away at patient trust.
Yeah, I can see that. And could lead people to just disengage from healthcare altogether.
Absolutely. Which, of course, just feeds back into those health inequalities we started with.
Mm-hmm.
Ultimately, this study really underscores something important. Reducing health disparities isn't just about collecting more data like SDHs.
It's how the data is used.
Precisely. It's fundamentally about how that information is interpreted and whose perspective, whose story is actually valued in that clinical encounter.
That really makes you think.
Yeah.
So here's something for all of you listening to consider. What if patients could actually co-construct their health records? If their narratives were truly shared right alongside the clinical notes, how might that change things? Could it transform patient experiences, maybe even improve health outcomes? What stands out to you about how our stories get told, or maybe untold, in healthcare?